Valentine's season, and as they say, if you want to know if he loves you so, it's in his kiss. But if the kiss doesn't live up to expectations, don't take it personally. It could be due to shyness, or maybe it's mouth dryness. And if dry mouth is the case, our dentists can help us get back into prime kissing condition. So here to tell us all about dry mouth are the dynamic dental duo of G Dental Group, Dr. Camille Corvera-Galang and Dr. Raemund Galang. Welcome back, guys.
Hi, thank you for having us again.
Okay, dry mouth. Nako, very important to for this prime kissing season.
Of course.
What's dry mouth and what causes it?
Dry mouth is really just lack of saliva or the lack of production of saliva.
Okay.
Scientific term yan is xerostomia, but it's called dry mouth.
Okay. And what causes dry mouth usually?
Well, it could be from dehydration, not drinking enough water, too much caffeine, alcohol.
I noticed that in a lot of drug commercials, yung mga side effects may include blah, 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 blah. It usually has dry mouth in there.
There's about mga 400 actually different types of medication that can cause dry mouth, 400? Yes. So also if you have some systemic diseases, like if you had mumps, that can affect your saliva. Okay, diabetes can also play a factor.
Right.
So all these things we have to consider.
Okay. So let's take a step back. You said that dry mouth is caused by lack of laway.
Yes.
Correct.
Right.
Yes.
Why is laway important? We don't usually think about that, but yeah.
Correct. Yeah, no, laway or your saliva, it's very important because it lubricates our mouth, it moistens it. It has a cleansing effect. It washes away all the debris inside our mouth, diba?
What are the effects of dry mouth?
Well, a lot of patients actually first don't realize that they have dry mouth. They come to us and say, Doc, people say I have bad breath.
Oh,
so that's number one side effect ng dry mouth is stagnant in their mouth, so bad breath.
Also, number one kissing killer. Go on.
Bad breath. And then, since dry na dry yung mouth nila, walang lubrication, you're more prone to getting cuts and sores in your mouth.
So, wounds inside the mouth.
Cavities too, gingivitis. Cavities kasi yung saliva mo, siya yung may fluoride, it carries of fluoride around. So, kung wala kang saliva to push everything, you're more prone to get rampant decay.
Rampant decay sounds very scary.
Okay. It really progresses so much faster pag wala kang saliva.
So in short, mas mabuti na pala yung tulo-laway kaysa walang laway at all.
Technically,
Okay. So for our poor Canadians out there, especially lalo na yung mga Canadian natin who are on medication regularly that makes them dry-mouthed, what do you usually recommend that they do?
Well, definitely, the first thing we have to establish is kung what causes it. Baka mamaya they're dehydrated lang pala. We have to address kung halimbawa you do have dry mouth caused by your medication. Siyempre, we'll tell you don't naman stop your medication because that's very important.
That's no excuse to not take your medication.
And so, but there are things out there over the counter that you can use. Maybe we'll go through some of these. Yes. First,
here we have the high fluoride toothpaste.
Okay, so high fluoride is good for those with dry mouth.
Exactly.
Because kulang sila sa
kulang
fluoride.
Sila sa minerals. And notice this one is specifically for dry mouth. So there are certain ingredients na tinanggal dyan para will not aggravate the dryness.
Okay. And then biotin, this is a spray that you can use. You spray inside your mouth kung feeling mo parang parched ka. You can spray it to moisturize your mouth.
Okay, great.
They have a good line of products. Also, this is a I believe alcohol-free mouth.
These are all alcohol-free mouth washes.
Yes.
Kasi alcohol causes more dryness pa.
I see.
Correct.
And are these cold medicine?
Yeah, we brought it out here just to show you an example. Now, some of these medications can actually cause dry mouth. These are,
common, even very common ones.
Common medications.
Allergy medications, cold medications.
And that's definitely something to keep in mind. Lalo na pag springtime, we always take that,
definitely
for your allergies.
Take it for granted yung pala. That's what's causing your dry mouth.
Wow, okay. So, well, I'm sure there's lots more questions that our Canadians want to know about, especially with regard to medication and how to treat it. Saan po kayo mahahanap?
Catch us at G Dental Group in Daly City. You can call us anytime, 650-991-7055, or you can email us and visit our website, www.gdentalgroup.com. So we're expecting you.
All right. Thank you so much, Dr. Galang. It's always a pleasure to have you here.
Of course,
and I will be sure to take care of my laway.
Yes. Especially for yes, there you go.
Jinx. Especially for Valentine's Day. I hope naman magde-date din kayo, di ba?
Siyempre naman. Siyempre naman.
Good. And to all you Canadians out there, happy Valentine's Day. We're going to take you to the patikim, sealed with a kiss. Mwah.
Mwah.